Imagine your blood cells suddenly deciding to transform from smooth, flexible discs into sharp, crescent-shaped weapons that get stuck in your blood vessels and cause pain so severe that morphine barely touches it. That's sickle cell disease, a genetic disorder where your red blood cells are literally the wrong shape, and it causes something called pain crises that patients describe as feeling like someone's pouring gasoline in your veins and lighting it on fire while simultaneously crushing your bones with a sledgehammer. Here's what makes this absolutely nightmarish. Normal red blood cells are smooth and round, flowing easily through your blood vessels like water through a pipe. Sickle cells are rigid, sticky, and shaped like crescent moons. They clump together and get jammed in tiny blood vessels, blocking blood flow and oxygen to whatever tissue is downstream. When that happens, you get a vaso-occlusive crisis, which is medical speak for your blood vessels are clogged and everything fed by them is screaming in agony because it's being starved of oxygen. These pain crises can happen anywhere in your body and strike without warning. One minute you're fine, the next minute you're on the floor, writhing in pain that feels like your bones are being shattered from the inside. The pain commonly hits the chest, back, arms, legs, and abdomen, and it can last for hours or days. Patients report pain levels of 10 out of 10, where even breathing hurts because expanding your chest means moving bones that feel like they're being crushed in a vise. Some describe it as feeling like someone's driving nails through their bones while simultaneously electrocuting them. Children with sickle cell often experience their first crisis in infancy with something called dactylitis, or hand-foot syndrome, where their tiny hands and feet swell up and become excruciatingly painful. Imagine a baby who can't explain what's wrong, just screaming inconsolably because their blood cells are jamming up in their fingers and toes, cutting off circulation. That's basically your introduction to a lifetime of random, unpredictable agony. Because apparently genetic lottery wasn't cruel enough, it had to add surprise pain attacks to the mix. But the acute crises are just part of the nightmare. Over time, repeated episodes cause permanent damage. The blocked blood flow kills bone tissue, leading to a vascular necrosis where chunks of your bones literally die and collapse. Your hips and shoulders are particularly vulnerable. One woman in her 30s had both hips replaced because decades of sickle cell crises had destroyed the bones so thoroughly that the joints disintegrated. The chronic pain from damaged bones never goes away. It's a constant background of aching that periodically explodes into acute crisis pain. Sickle cell can also cause leg ulcers, open wounds that develop from poor circulation and refuse to heal for months or years. These ulcers are described as burning, aching sores that make walking torture. And here's the really twisted part. There's no way to predict when a crisis will hit. Could be tomorrow, could be next month. You live in constant fear of the next attack. Your bone marrow is supposed to produce healthy blood cells. With multiple myeloma, it instead starts cranking out cancerous plasma cells that literally eat holes in your bones from the inside out. We're talking about a cancer that turns your skeleton into Swiss cheese while causing pain so severe that patients describe it as feeling like their bones are being dissolved in acid while someone repeatedly breaks them with a hammer. Here's what makes this particularly horrific. The cancer cells accumulate in your bone marrow and release substances that activate osteoclasts, which are cells that break down bone tissue. Normally, this process is balanced with bone formation, but in myeloma, it's all destruction with no rebuilding. Your bones develop lytic lesions, which are literally holes where the bone has been eaten away. The spine, ribs, skull, and hips are the most common targets. Imagine your vertebrae developing hollow spots that make them structurally unsound, like termite damage in a wooden beam, except the beam is holding up your entire body. The bone pain is typically the first symptom, and it's constant, deep, and aching. Patients report feeling like their skeleton is being crushed from within. The spine is particularly vulnerable, and the pain there is described as sharp, stabbing sensations that shoot through your back with every movement. One man said it felt like someone was driving screwdrivers between his vertebrae while simultaneously hitting his spine with a baseball bat. Simple acts like getting out of bed, sitting in a chair, or even breathing deeply can trigger excruciating pain. But it gets worse. The weakened bones fracture from minimal stress. We're talking about vertebrae collapsing, from the simple act of standing up, ribs breaking from coughing, or your hip shattering because you rolled over in bed. These are called pathological fractures, and they happen to about 60 to 70% of myeloma patients. One woman fractured 3 ribs while putting on her jacket. That's like breaking bones from the physical exertion of getting dressed, which sounds absurd until you realize your skeleton has been hollowed out by cancer cells. The nightmare escalates when the damaged vertebrae collapse and compress the spinal cord. This is an oncological emergency called spinal cord compression, causing sudden, severe back pain that radiates down your legs, accompanied by numbness, weakness, and loss of bladder control. If not treated within hours, the paralysis becomes permanent, so you're dealing with constant bone pain, random fractures, and the looming threat of sudden paralysis. Multiple myeloma also causes peripheral neuropathy, where the abnormal proteins damage nerves in your hands and feet. This adds burning, tingling, stabbing pain to the mix. Patients describe it as feeling like their extremities are being electrocuted or stabbed with hot needles constantly. So you've got bone pain, fracture pain, and nerve pain all happening simultaneously. Treatment involves chemotherapy that causes its own pain and side effects, plus radiation that feels like being microwaved from inside your skeleton. Your bone marrow decides to overproduce red blood cells, turning your blood into something resembling sludge that barely flows through your vessels. That's polycythemia vera, a rare blood cancer that causes your blood to become so thick it's like trying to pump molasses through your circulatory system. This leads to headaches, so severe patients describe them as feeling like their skull is being crushed in a vice, while someone drives ice picks through their eyes, plus the constant threat of blood clots that can kill you instantly. Here's what makes this insidious. Red blood cells carry oxygen, so you'd think more is better, right? Wrong. When you have too many, your blood viscosity increases dramatically, making it harder for your heart to pump blood through your vessels. The thick, sluggish blood doesn't flow properly, causing tissue hypoxia, where your organs aren't getting enough oxygen despite having excess red blood cells. It's like having a traffic jam in your circulatory system where too many cars on the road means nobody can move efficiently. The headaches are relentless and debilitating. Patients report constant pressure and pounding pain that worsens with physical activity or when lying down. Some describe it as feeling like their brain is swelling inside their skull, with nowhere to expand. The thick blood also causes a condition called erythromelalgia, where your hands and feet become red, hot, and intensely painful with a burning sensation. One patient said it felt like his feet were being held over open flames. The only relief comes from cooling them with ice, water, or fans, which provides temporary respite from the burning but doesn't address the underlying cause. But the real danger is the blood clot. The thick, sticky blood is prone to forming clots that can lodge anywhere in your body. A clot in your brain causes a stroke, in your heart a heart attack, in your lungs a pulmonary embolism, in your legs deep vein thrombosis. About 30 to 40% of polycythemia vera patients experience a thrombotic event at some point, and these events can be sudden, catastrophic, and fatal. Imagine going about your day and suddenly having a massive stroke because your blood is too thick to flow properly through your cerebral arteries. The disease also causes your spleen to enlarge massively as it works overtime to filter the excess blood cells. An enlarged spleen causes a constant, dull, aching pain in your upper left abdomen that patients describe as feeling like something's pressing against their organs from the inside. In severe cases, the spleen can rupture, causing internal bleeding and excruciating abdominal pain. Polycythemia vera can progress to myelofibrosis, where your bone marrow gets replaced with scar tissue. This causes the blood cell production to shift to your liver and spleen, making them enlarge even more. The scarring process is painful, and the disease progression often leads to acute leukemia, which has its own nightmare of symptoms and a very poor prognosis. Your bone marrow just stops working. It quits producing red blood cells, white blood cells, and platelets, leaving you with blood that can't carry oxygen, can't fight infections, and can't clot properly. That's aplastic anemia, a rare condition where your body essentially gives up on one of its most fundamental functions. While not primarily known for acute pain like other blood diseases, the suffering comes from the cascading failures that follow when your blood system collapses. Here's what makes this a slow horror. The extreme fatigue isn't just tiredness. It's the kind of exhaustion where climbing stairs feels like running a marathon and thinking clearly becomes impossible because your brain isn't getting enough oxygen. Patients describe feeling like they're moving through thick fog, their bodies heavy and unresponsive. One woman said she felt like she was drowning on dry land, constantly gasping for air but never getting enough oxygen, no matter how deeply she breathed. That's what happens when your red blood cell count drops so low that your tissues are starving for oxygen. But the real nightmare comes from the lack of white blood cells and platelets. Without enough white blood cells, even minor infections become life-threatening. A simple cold can turn into pneumonia. A small cut can become sepsis. Patients live in constant fear of infection, isolated from friends and family because exposure to common germs could kill them. They describe the psychological torture of being imprisoned in their own homes, avoiding public places, wearing masks everywhere, and still getting infections that land them in the hospital for weeks. The platelet deficiency causes spontaneous bleeding that's both painful and terrifying. Patients develop bruises from the slightest touch. Their gums bleed constantly. They get nosebleeds that won't stop. Internal bleeding in the brain or gastrointestinal tract can happen without warning. One man woke up to find his pillow soaked with blood from his nose and mouth, bleeding throughout the night. The constant bleeding causes a deep aching pain and the psychological horror of never knowing when or where the next bleed will occur. Treatment is equally brutal. Blood transfusions every few weeks just to maintain basic function. Immunosuppressive therapy that makes you even more vulnerable to infections. Bone marrow transplant, which is one of the most painful and dangerous procedures in medicine, requiring total body irradiation or chemotherapy that destroys your existing marrow before replacing. The transplant process involves involves weeks of excruciating mouth sores, gastrointestinal pain, and the risk of graft versus host disease, where the donated cells attack your body. The psychological pain is perhaps worse than the physical. Aplastic anemia can be fatal, and patients live with the constant awareness that their bone marrow might never recover. They're dependent on transfusions, medications, and medical interventions just to survive each day. One patient described it as feeling like his body was a car slowly running out of all its vital fluids with no way to refill them, just watching the gauges drop toward empty while hoping for a miracle. Your blood can't clot properly, which means any injury, no matter how minor, can cause bleeding that won't stop without medical intervention. That's hemophilia, a genetic disorder where you lack the clotting factors that normally seal up damaged blood vessels. While external bleeding is manageable with treatment, the real horror is internal bleeding into joints and muscles that causes pain. So severe patients describe it as feeling like their joints are being crushed in a vice while someone pours acid into them. Here's what makes hemophilia uniquely torturous. When you have normal clotting factors, a bump or twist that might cause a small bruise gets sealed up quickly by your clotting system. With severe hemophilia, that same bump causes bleeding into the joint space, a condition called hemarthrosis. Blood accumulates in joints like the knees, elbows, and ankles, causing them to swell up like balloons. The joint capsule stretches, pressing on nerves and causing immediate, intense pain that patients rate as 9 or 10 out of 10. A child with hemophilia might fall while playing, and within hours, their knee swells to twice its normal size, hot and excruciatingly painful to touch or move. The blood in the joint doesn't just cause acute pain, it triggers an inflammatory response that damages the cartilage and bone. One teenager described his knee bleeds as feeling like someone was inflating a balloon inside the joint while simultaneously stabbing it with broken glass. The pain makes movement impossible, and without prompt treatment with clotting factor, the bleeding continues for days. But the real nightmare is the long-term damage. Repeated bleeding into the same joints causes chronic hemophilic arthropathy, which is basically arthritis on steroids. The blood breaks down and releases iron and enzymes that destroy cartilage and erode bone. By their 20s, many hemophilia patients have joints that look like those of 80-year-olds with severe arthritis. The chronic pain is constant, aching, and grinding, made worse by any movement. Some patients require joint replacements before age 30 because the damage is so extensive. Muscle bleeds are equally horrific. Blood accumulates in muscle compartments, creating pressure that can compress nerves and blood vessels. This causes a cramping, crushing pain combined with tingling and numbness as nerves get squeezed. In severe cases, the pressure becomes so high it causes compartment syndrome, requiring emergency surgery to release the pressure before permanent nerve damage occurs. One man had a muscle bleed in his forearm that swelled so severely it compressed his median nerve, causing his hand to become paralyzed and turning the pain into an electric burning sensation that shot from his elbow to his fingertips. The psychological burden is crushing. Hemophilia patients live in constant fear of injury. Simple activities like sports, running, or even walking on uneven ground carry the risk of a bleed. Children with hemophilia are often overprotected by terrified parents who've watched their child scream in agony from internal bleeding. The disease robs people of normal physical activity and leaves them with chronic pain from damaged joints that serves as a constant reminder of their genetic curse. So what connects these 5 blood nightmares? They all prove that the liquid flowing through your veins, the very substance that keeps you alive, can become a weapon against you. Whether your blood cells are the wrong shape and clog your vessels, your marrow produces cancer cells that eat your bones, your blood becomes too thick and clots randomly, your marrow shuts down entirely, or your blood can't clot when it should, the result is the same. Your circulatory system transforms from life support into a torture device. We've developed treatments that can manage these conditions, but we still can't cure most of them, leaving patients trapped in bodies where their own blood is slowly destroying them from within.